Hello, everyone, and welcome to today's webinar, Understanding Health Insurance Benefits. My name is Lindsay Nienbrink, one of the care coaches here at Jasper, and I will be hosting our webinar today. We are very excited you are able to join us. Before we get to the webinar, I want to share a few housekeeping notes. You will notice everyone's mics are muted and cameras are turned off. This is intentional to keep us focused on the webinar. Please reach out to support at Hello Jasper if you are experiencing ongoing technical issues, but please note our limited capacity to address these issues while the webinar is running. These concerns will be addressed at the conclusion of today's webinar. We are recording the webinar and will upload it to our website. Please make sure to include any questions you have in the chat box so that we can address all questions at the end of the presentation. For those of you joining us today, I would like to do a quick poll that you will see pop up on your screen, and if you could please take a minute to answer the poll. Just give you a few minutes to fill it out. Okay. Now let's take a look at what you can expect during today's webinar. Today's session will focus on a few key areas. First, we will share a little bit about Jasper Health and the programs available to you through our app and website. We will then answer the loaded question, why is it important to understand my insurance benefits? We will review what is health insurance and why it is important to have, as well as key terms that are important to know when it comes to health insurance benefits. We will discuss what the difference between in and out of network coverage is. We will also discuss important documents such as an EOB, why it is important, and what you should be checking on your EOB. We will also be going over what financial toxicity means and how it can affect you. Lastly, we will end the webinar with a Q&A. Now, what is Jasper Health? Jasper is a digital oncology platform. It is available to anyone touched by cancer. When enrolled in Jasper, members receive custom recommendations. They are able to track their moods and symptoms, medications, appointments, and are provided educational articles based on their interests and side effects as they indicate. Our members receive one-on-one support and guidance through personalized plans and psychosocial support. Jasper Health addresses the lack of whole person support and gaps in holistic care. We meet each member where they are at on their cancer journey and help to support them as a whole. Addressing their individual needs, and as their needs change, we adapt our assistance to guide them. That means if a member is newly diagnosed, in treatment, in remission, palliative care, and even caregiver support, we provide full support to them. The Jasper app acts as a smart planner, a tracking tool, and a resource hub all in one. And our Jasper care coaches act as an extension of traditional care and are available 24/7 to address aspects of the whole person, like helping with appointments, providing financial guidance, emotional and mental health support, nutrition and meal planning, remission and survivorship support, and much more. Currently, we are supporting approximately 16,000 members and caregivers as they navigate their cancer journey. I am thrilled to co-host today's webinar with my fellow coworker, Haley, and we are glad that you have joined us to learn more about financial toxicity. Before I introduce our speaker, Haley, I just want to mention, Jasper Cancer Care Coaches are oncology trained and range with a variety of expertise as nutritionists, registered nurses, social workers, and financial counselors. However, our cancer care coaches do not provide advice on treatment decisions, nor provide or supplement clinical care from your current healthcare professional team. As coaches, our scope of practice focuses on psychosocial care, which is a whole person approach to cancer care, addressing the social, emotional, spiritual, and physical aspects with an emphasis focusing on members' strengths, interests, and natural motivation to provide confidence, empowerment, and self-advocacy along their cancer journey. Now, on to our wonderful care coach and speaker for today's webinar, Haley. Haley is a national board certified holistic nutrition practitioner and care coach here at Jasper Health. Previously, she was a wilderness EMT, holding over a decade of experience in the healthcare sector. According to Haley, being able to support others during these times of need is an honor and a privilege, a true life calling. Her goal at Jasper is to guide our members and caregivers through support and resources and being that much needed shoulder to lean on so that a member or caregiver never feels alone on this journey. Please join me in welcoming Haley, and we will get started. Hi, Haley.
Hey, Lindsay, thank you so much for that intro and giving our members a little taste of Jasper. And before we move into health coverage and learning some key terms, I do want to pull up a quick poll just to do a little check-in. Let me relaunch that. Okay, and I'll give you just a moment to answer that. All right, thank you so much for participating in that. I appreciate it. Okay, so moving on, we're going to cover some key points here. So first, I just want to touch on how does health insurance work? So health insurance companies often contract with certain hospitals, doctors, pharmacies, and other healthcare providers to deliver medical service for an agreed upon rate. These providers are known as health insurance companies providers network. Health insurance companies create various provider networks to develop different health plan options for the members to choose from. Key points in health coverage. So consumers purchase health insurance or enroll in other health coverage to help pay for medical and avoid serious financial hardship in the future. Health insurance companies often contract with groups of big hospitals, doctors, like I said before, and pharmacies to provide those healthcare services for an agreed upon rate. Health insurance, excuse me, sorry, health insurance. So consumers purchase that. Health coverage is what it actually covers under that health insurance policy. And eventually the EOB, which is the explanation of your benefits. And we will dive more into those here in the presentation. So a few key vocabulary terms that we'll be going over today include premiums, co-payment, deductibles, co-insurance, and maximum out-of-pocket. These terms are commonly used in discussions surrounding health insurance. So when you visit the doctor, among other various scenarios in relation to your cancer journey. To break these down, I will be providing you with a definition of each term, as well as a real-life example on how they are used in the healthcare setting. First up is deductible. This is the amount you have to pay out of pocket for healthcare services before your insurance picks up a portion or all of the remaining cost. In this example, your deductible is $700. Let's say you go to the office, your physician's office, that costs you $200 and you are expected to pay that in full. And then you have a remaining $500 before you reach that deductible that you will have to continue to pay. Next is co-payment. So this is more commonly known as copay. This is a fixed amount that you're required to pay each time you have a medical encounter. This is, again, after the deductible has been met. This may include office visits, when you pick up a medication at your pharmacy, or when you have a hospital stay. In this example, you can see that, again, you have not met your deductible. You visit the oncologist, and that costs you $100. Your copay is a $25 set fee, leaving your insurance to cover $75 for this visit. So again, you're only responsible for that $25 copay for this visit. So similar to co-payment, we have co-insurance. This is the percentage of the cost of healthcare services you must pay after you have reached your deductible. This is different from co-payment because it is a percentage of the cost rather than a fixed amount. In this example, you have reached your deductible. Your co-insurance is 10%. You see your primary care doctor, whose office visit costs $200. 10% of 200 is 20. So you are responsible for that $20 charge, and then your insurance picks up the $180 that is left over. Finally, we have maximum out-of-pocket. So this is the amount an individual is required to pay within a plan year. This typically includes costs such as your deductible, co-insurance, and co-payments, everything that you have to pay as an individual. To break this down, let's say your deductible is $700 and your max out-of-pocket is $3,000. You have reached your $700 deductible and you now pay 20% in co-insurance each time you visit the doctor, until you have paid a total of $3,000. Once you have paid that total of $3,000, your insurance plan will then cover all of the healthcare related expenses at 100%. So now that we've touched on key vocabulary, picked all that up, let's jump into the two most common types of insurance plans. We go. First up is HMO, or Health Maintenance Organization. This is a type of health insurance plan that usually limits coverage to care from in-network doctors who work for or contract with that HMO. These plans usually require consumers to get a referral from their primary care doctor to visit a specialist, and they generally won't cover out-of-network care except for in an emergency or if something has been pre-approved. In exchange for the limited access to providers, premiums, which is the amount you pay every month, are typically lower in an HMO than in other types of plans. Next up is PPO, which is Preferred Provider Organization. This is a type of health insurance plan that usually limits coverage to care from in-network doctors who, excuse me, sorry. Insurance premiums are higher in a PPO than they are in an HMO. Your deductible is usually lower, and you can see your primary care physician or a PCP or with without a referral. You also have access to out-of-network benefits, and you have a wider selection of hospital doctors and specialists that you can choose from to see. Now, we mentioned in and out of network coverage quite a bit in those last slides. So I just want to touch on those here. Network is the doctors, facilities, and hospitals that are contracted to participate with your insurance company. An in-network provider is a provider or a facility. So facility meaning a hospital that participates with or is under contract with your health insurance provider. By using a network provider, your share of the cost will be lower. And an out-of-network provider is a provider or a facility, again, a hospital, that does not participate with or is not under contract with your health insurance provider. When using an out-of-network provider, your cost share is higher. And in addition, out-of-network providers can balance bill for the remaining costs not allowed by your insurer. And balance billing is just a method by which the out-of-network provider can charge the consumer for the cost of services not covered by the insurer. Okay, so now we're moving on to key documents that are associated with your health insurance plan. First up is an EOB, or an explanation of benefits. So this is something the insurance company sends you when it gets a request for payment for one of your healthcare services. An EOB is not a request for payment from you. So when you receive this, this is not a bill to you. This is more or less a statement of what is requested to be covered by your insurance company. This describes the medical treatment you got from the provider. This is very important because it is your chance to review the money that's being paid for by your healthcare. So by checking your EOB, you can track how much your healthcare costs. You can also look for billing errors, and you can have a chance to question any payment that doesn't look quite right. The information on an EOB should show your name and address, your policy number, the name of the patient that required the services, as well as the provider that provided you care. You should check a few things on your EOB. So we should look at the date that was provided for the service. the doctor's name, anything that you were being billed for. And we want to look and see if there's something that may be billed more than once. Also, whether you have to pay any or all of the bill because you haven't met your deductible, and if the insurance company may have rejected that claim, and it should give a reason why. Next up is the summary of benefits. This varies from your explanation of benefits. So explanation of benefits is something that occurs after you have seen the provider. An SBC, or summary of benefit coverage, is a snapshot of the health plan's costs, benefits, covered healthcare services, and other features that may be important to you as the consumer. So this can also explain the health plan's unique features like cost sharing rules, and include significant limits and exceptions to coverage in an easy to understand term. Along with SBC, group health plans and health insurance companies must also provide a uniform glossary to explain common medical and insurance related terms, similar to what we did earlier in this presentation. Last up for documents is certificate of coverage, or a COC. This is a contract that lists an individual's health insurance coverage with their payer. So the COC details the health benefits the beneficiary and the dependents, or the covered people, under the plan. Details include exclusions and conditions. So these may be uncovered services, and conditions or actions needed to receive the benefit. Conditions may also include deductibles and copays. These are important to healthcare because they provide valuable information on the terms of health insurance plans to the involved parties. Individuals can reference this information in making informed medical care decisions, and also contain information that individuals can use to appeal decisions made by the payers. So again, if you see something on the EOB that may have been rejected, this is something that will give you a little more information on how to go about that and start an appeal process. So finally, we have, what is financial toxicity? We hear this term thrown around quite a bit in the healthcare space, and especially here at Jasper. So we really want to address this and want to define it. So this describes the negative impact medical expenses can have on a patient in terms of their healthcare. So this can lead to negative mental and physical effects, and in some cases, bankruptcy, loss of job or income, or even homelessness in the most extreme cases. Not having a health insurance plan or having a lot of costs for medical care not covered by health insurance can cause financial distress. Financial toxicity can also affect a patient's quality of life and access to medical care. For example, a patient may not take a prescription medicine or may avoid going to the doctor to save money. Cancer patients are more likely to have financial toxicity than people without cancer. So having health insurance is the most effective way to reduce financial toxicity. Understanding your coverage and what you can expect to pay for treatment is very important. So begs the question, do I suffer from financial toxicity? And that was a lot of info. So we're now leaning into the recovery from financial toxicity. So I do want to pull up another poll. So we want to review these questions that you see on the slide. In the past 12 months, have you had difficulty paying your bills? Worry about your expenses versus income? Took less than your prescribed amount of medication? Or missed physician's appointments to avoid costs? And I'm going to pull up this poll. Okay, and I'll give you just a minute here. I just want to know if anybody answered yes to any of those questions on the slide. Okay, thank you very much for participating in that. Okay, so let's talk a little bit about how to overcome financial toxicity now. So here at Jasper, we have an extensive library available to you after you sign up for your Jasper account. Specifically, we have many articles surrounding financial resources, how to plan with your finances, and how to really reach out. Our coaches here at Jasper are here for you. And you can use the chat feature on your account and reach out to us. We can provide those resources, provide you with the right article that might be applicable to you. And also, we have some wonderful nonprofit partners that we work with. We have around 50 at this point, but we are growing every day to make this list as long as possible for members like you. So to get more information regarding any of these resources, the library, more information on our nonprofit partners, you can visit our website at hellojasper.com and explore our resources section. And again, utilizing that chat feature in your Jasper account to reach out to a care coach like me and Lindsay. We are definitely here to help and provide you with the resources you need and steer you in that right direction to overcome any financial distress you may be experiencing. Okay, and so finally, before we open the chat for questions, I just want to review what we've talked about today. So we gained a better understanding of health insurance, learned a lot of vocabulary terms, absorbed a lot of information, and we kind of had an insight on how to avoid financial toxicity and how to overcome that financial distress. So let's open up the chat, Lindsay, and see if there are any questions here for us. Okay, so Lindsay, this may be something you can speak to very well. As an oncology social worker, do you feel there are enough resources available for cancer patients today?
So I do believe there are enough resources. I just think the awareness of the resources is what's lacking, which is so great about us partnering with 50 nonprofit partners to bring awareness to the wonderful resources available. And to speak to that as well, while there are financial resources, there sometimes is lack of funding. But again, if you know about the resource, where to look, and have a great program and a care coach to guide you, you can get linked up with the appropriate resource, financial resource that has funding available.
Yeah, I definitely agree with that. There's a lot of information out there. It's kind of relatable to, you do a Google search and you get hundreds of pages.
Yeah.
And it's hard to narrow those down and find the one that will work for you. So
it can be overwhelming.
It definitely can be. Let's see.
I see one that came in. It asks, do I have to have a Jasper account to access the library?
So yes, you do have to have a Jasper account to access our library. Again, we have numerous articles on many different topics. But yes, you do have to sign up for a Jasper account to access those.
Very good.
All right. Well, thank you all so much for attending today. It was a great honor to be able to touch on such a sensitive topic. I do want to remind you that we do have a webinar coming up February 22nd at 1:30 Eastern, and this is going to be surrounding caregiver support, along with a nonprofit partner of ours, Red Door Community, and Lindsay will actually be hosting that. So be looking out for that email to register for that and join us for a wonderful webinar. I hope you guys have a great rest of your day, and we look forward to seeing you again.
Thank you.